Hi everyone, my name's Jen. I'm a physical therapist here at Colorado Springs Orthopaedic Group. Today I just want to walk you through a couple initial gentle exercises for your shoulder that you can do before your first post-op physical therapy visit. Depending on the surgery you might have had done, your surgeon might have given you some post-op range of motion restrictions, so make sure you abide by those with any of these exercises. The intention of these exercises is to really help get the shoulder moving, get you more confident in moving your shoulder again, and helping reduce some initial stiffness after surgery. First exercise we call scapular retractions. You can either sit or stand tall and gently squeeze your shoulder blades together like you're trying to pinch a pencil between them. You can hold for a count of 5, then relax. This strengthens the muscles that stabilize your shoulder blades, which is super important for healthy shoulder mechanics. Feel free to do maybe 5 to 10 of these at a time, and you can maybe do these a couple times throughout the day. With this exercise, you can do it in or out of your sling, but if you are out of your sling, make sure you still have your arms supported either by your belly or by your side. This next exercise is called pendulums. You can lean forward slightly and let your arm hang loose. You can support yourself on a table or counter if you need to with the side that you did not have surgery on. Use your body to gently sway, allowing your arm to move in circles or back and forth like a pendulum, but do not actively lift the arm. This is all about passive motion and relaxing the shoulder. Feel free to perform this maybe 30 to 60 seconds at a time, and you can repeat maybe 1 to 2 times and a couple times throughout the day. The next exercise we call passive flexion table walkouts. So you're going to stand beside a table and rest your hand on it, but make sure to not put any weight or pressure through the arm that you had surgery on. You're going to slowly walk your body backward until you feel a slight stretch in your shoulder. You'll then walk back forward and then return to the starting position. With this one, make sure to avoid any sharp pains in the shoulder. You can perform this again 5 to 10 times, and you can do that a couple times a day. The next one is called table slides. You can sit down and place a towel or slider under your hand. You can then place your non-surgical side on top of that hand. Slide your hand forward on the table, keeping your palm down, and you can let your trunk lean in slightly to assist. Again, we're aiming for passive shoulder movement to encourage mobility. It's especially important with this one to, again, avoid any sharp pains with it. You can perform this 5 to 10 times, and again, maybe 2 to 3 times a day. This next exercise we call external rotation with a wand, broomstick, or dowel rod. You can also use a cane if you have one. You're gonna hold the wand in both hands, with your surgery side being at one end. You're going to try and keep your elbow in towards your side as best as you can, and also have a pillow or a towel underneath your surgical side for support. You can then use your non-surgical side to help push the dowel rod or cane outward into an externally rotated position. You're then going to use your non-surgical side to help pull it back to the starting point. This one is easy to compensate here, so go very slowly, and again, avoid any sharp or stabbing pains in the shoulder. And you can perform 5 to 10 times, a couple times a day, or as pain allows. And finally, let's add a simple movement for your elbow to make sure you're maintaining full range there too. If you have pain with it trying to bend or straighten your elbow on your own, you can use assistance from your opposite hand. It's going to work on bending and straightening your elbow. This helps keep you mobile while your shoulder recovers. Maybe 10 times, a couple times a day, especially if you're spending some time out of your sling. Consistency with these exercises can make a big difference in your recovery, especially early on. If you're unsure about form or have discomfort with any of these, feel free to reach out to your PT for additional guidance or assistance.